So thank you for joining me today. I've got Emma with me, who is a haematology consultant but specialises in, lots of stuff. Tell us a little bit about what it is that you do, please.
So my post is actually funded by the Christie charity, and I'm here to look after patients who don't have standard of care treatments available to them anymore. So I lead a team which run clinical trials of experimental treatments for patients really all over the north of England who would like to take part in a clinical trial and to help us learn more about treatments of the future.
So what does that mean for patients if they're approached to be part of the trial?
Yeah, so we have referrals from all over. Really, it's at the point where patients are trying to decide between taking part in a clinical trial and trying an experimental treatment for their blood cancer, or being supported to feel as well as possible in the remaining time that they have left at home. And so if they choose to take part in we can't make progress in treating blood cancer and understanding how to cure more people without patients who are willing to volunteer to give up their time to come and take part in these trials. But they are quite involved for patients. We see a lot of them. Most of our patients are in for a review every week or every fortnight, and we get to know our patients really well. Some of those patients will do really well on those experimental treatments, and that's nice for everyone involved. And some of those patients, unfortunately, won't respond to the trial treatments. But every patient that takes part helps us learn more about how we can better treat these cancers.
And obviously, you're talking to patients at a time, it's a really, really tough time for them. How do you frame those conversations? How do you make sure that patients are fully aware and fully understand what's going on?
So I think it's really really important to understand what a patient wants from the remaining time they have left. For most of these experimental treatments, we don't expect to be able to cure. We may be able to send away their cancer for a period of time, but it will come back. So for some patients, how they want to spend their remaining time is trying to contribute to research to help make things better for patients that come after them. And for other patients, that's not the right choice. They just want to maximise time at home with their family. And so a lot of those first couple of consultations that we have with patients are about understanding what's important to them. I can tell them what's involved in taking part in a trial and what the likely side effects are of any experimental treatment that we might give, but only they can decide whether taking part in a trial is right for them as an individual.
And what generally is involved in taking part in trials? Because I think we hear the word clinical trial and don't know much more sometimes, especially when you're a patient and it's not been your world.
So they are very variable. I've got some, and sometimes we'll have a couple of different options for patients and we can talk those through. Some of them will just involve taking a tablet, mainly at home, although, like I said, we probably would expect them to come to see us at least once a week for the first month. Some of our trials are really involved, have some treatments that kind of look to harness the power of the immune system, and I may ask a patient to stay in hospital for 3 weeks at the beginning of those trials, so they can be a lot more demanding on a patient's time. So yeah, very variable, but we take them, we spend lots of time with the patients, taking them through exactly what would be involved in any particular trial to the best of our knowledge.
What led you to getting involved in clinical trials? What was it that interested you? So
actually, it was kind of breakthroughs in targeted cancer treatment that first inspired me to become a haematologist. So there's a type of blood cancer called chronic myeloid leukemia that at the point I was just deciding what to do as my medical career, changed from a disease that killed nearly everybody unless you could have a bone marrow transplant, to a disease that we could manage like a chronic illness with a tablet treatment. And that really inspired me to become a haematologist. So I had an interest in kind of new developments and research from very early on. And then I spent a number of years at the university getting research training, doing a PhD. And while I mainly did that in the lab, I always knew that I was a clinician through and through, and I missed patients. And so it was a natural transition, really, for me to then take those research skills that I'd learnt, but move them into working with patients.
There's no such thing as a normal day in anyone's career. But what does typical normal look like for you? What can you expect to get up to?
Yeah, so again, one of the nice areas of working in research is we're always doing different things, and I get to meet a whole range of patients from lots of different places, and I have time in my clinics to get to know them and their families. But we always have a very hectic start to the week because a lot of the trials, the way they're scheduled means that we have busy clinics Monday and Tuesday. So we'll see all of the patients who are starting on trial treatment or on trial treatment, make sure that they're okay and give them their next lot of treatment. And then the second half of the week is lots and lots of meetings generally. So an important part of being a trials doctor is communicating with the sponsor, so the company that make the trial drug, and also with doctors who are seeing patients elsewhere in the world. So quite a lot of my week is spent in meetings, talking about all of the patients coming onto trials, learning about any side effects that we're seeing, understanding what doses we need to be giving to get to see more patients responding, and sort of fine-tuning those treatments and planning for the next lot of patients. And then, like every job, there's lots of paperwork.
I think you're playing down the paperwork. I've seen some of the files. Not read them, obviously, but
Yeah.
there's a lot of paperwork.
There is, because when we're giving experimental treatments, it's really, really important to have very, very high quality levels of documentation about every little thing that happens to them. So I always say to all my patients, I want to hear about everything. You know, your sore toe, I want to hear about it. So we document absolutely everything so that, and feed that back as quickly as possible. So certainly within a week for a non-serious problem, but 24 hours for a serious problem. So that everybody involved in the trial across all of the sites in the world that are participating, knows about everything that's happening with patients that might have implications for other patients in the trial.
When patients come to you, what are patients' biggest concerns for starting a trial, do you think?
Some of them will be worried about side effects. Some of them will be worried about how much time they're going, how long will clinics take, how much time are they going to have away from their family. Some just want to talk through again, what it means for them in terms of symptoms as their cancer progresses. What will that look like? They'll have generally always had those conversations with their local teams, but sometimes that is the alternative. Sometimes to taking part in the trial is to let nature take its course without any intervention. So they may want to talk through that as well.
You mentioned earlier about what inspired you to come to do haematology and sort of like developments and stuff like that. What sounds like a job interview question? What's been your proudest achievement so far?
I think just that as a team, we've worked really hard to try and up our capacity to see and treat as many patients as we could. The reason that we wrote the business case to the Christie charity, and we were lucky enough to get their support for my post, was that London centres were offering experimental therapies, and there were bits and bobs happening elsewhere in the country, but there was really no dedicated service for patients in the north of England. So I think my proudest achievement is that patients don't have to travel to London anymore. In the main, we hope to find an option for them here at the Christie if they want to take part in an experimental trial, and not leave them with that choice of not taking part in a trial or really travelling a long way from home.
I'm asking everyone this question, so you can't get out of it, I'm afraid. Lots of people have misconceptions or myths surrounding clinical trials and clinical research. If there was one that you could bust, or the one that comes to you the most option, like what would that one be that you just want to just go, gone?
I understand the joke, but a few patients will come to me saying, I want to be a guinea pig, or they kind of align what we do with humans to animal research that they might have, and I always feel a little bit uncomfortable about that. Animal research does take place in cancer treatments, but it's very different, obviously, what we do in clinic now. They absolutely aren't guinea pigs. They're individuals with a cancer diagnosis but a whole set of priorities that's individual to them. And we try and have a holistic approach to looking after them. So yes, they're taking part in a clinical trial, but that's not the only element of how we would hope to look after them.
So how else do you look after them?
So a lot of working with the local centres as well. So a lot of these patients, while they're going through the treatments, will need emotional and practical support. Sometimes that involves speaking, we have to have really effective communication with their local specialist nurses. Our research nursing team provide a lot of emotional support for the patients and their families as well, where we try and be a really consistent point of contact for patients taking part in the trial with whatever issues they're experiencing. That might be financial, it might be in terms of treatment side effects. So we try and look after all of those aspects of their care.
Great. Thank you so much, Emma. Appreciate your time, and thank you for talking to me today.